sessions over the course of the semester, I really try to understand the outbreak from a wide range of perspectives and experts that we have available to us in public health. We ultimately want to use Ebola as a lens to examine the outbreaks and other public health disasters and consider our role as future public health professionals. Today's topic is just an introduction, looking at Ebola in context, and we'll just kind of see where the discussion flows from there. We have three great speakers today, and for sake of time, I'm going to let them introduce themselves. But thank you so much for coming out, and I hope you enjoy the discussion.
Okay, I'm going to use my opera voice, which hopefully gets to the back of the room. We don't have a microphone. My name is David Fisman. I'm an infectious disease physician and an epidemiology professor here at the School of Public Health.
Hi, everybody. I'm Ross Upshur. I'm currently the head of the Division of Clinical Public Health at the school, at the Dalla School, and a professor in family and community medicine here at the University of Toronto.
And I'm James Orbinski, and I'm research chair in global health at the Facility School of International Affairs in Waterloo, and I'm also on faculty here at the Dalla School of Public Health.
I could?
Yeah.
All right.
So this is an informal series, so there's no PowerPointology. And as was mentioned in the introduction, it's about public health, but Ebola just seems to have got everybody interested in public health. And what we'd like to do is raise questions and think it through from the many diverse lenses that public health allows us to look at it. So if you have suggestions for topics and speakers, let us know. What we'd like to do is for each of us to sort of have three key takeaways that we think each student in public health might want to take from this last year's experience, and it's probably going to go on for another year. And at the end of this set of lectures, we'll have a kind of distilled set of wisdom, or lack thereof, depending on who's giving the pearls. So it's meant to be informal and interactive, not prescriptive, because I think we all need to learn from this yet again. So I'll turn it back to my esteemed colleague, Dr. Fisman.
Oh, sure. Okay. I mean, as panelists, the email we had sent around, aside from saying we're going to stay away from PowerPoint, we were asked to identify three key lessons that we've learned over the last year from events. And we also discussed, and I don't know a ton about this, but there's a Japanese paradigm of the 5 whys. You know, because this, I think this is an event that has surprised many of us. So we might want to know why this has happened. And there's this approach that says, well, ask the question why 5 times, go upstream, go upstream, go upstream, go upstream. And by the time you're at the 5th why, you may understand the true upstream cause of what you're experiencing, what you're witnessing. I think this has been used a lot, for example, in quality control in Toyota, where they make cars and they want to know why the wheel's wobbly, what have you. But we'll apply it to what I hope I'm not out on a limb here. I'm going to call a massive systems failure at a global level that resulted in what we've witnessed, 21,000, 22,000 official Ebola cases with well over 8,000 deaths, assuming there's a lot of undercounting. So with that, I can tell you what my 3 major lessons are, because I've struggled with 5 whys. I can get only so far upstream, and then I'm confronted by my ignorance about the geography and history and culture of the most affected region, and then I start to muddle around. But here's what I've learned and what I'll tell my students. Number 1, and those of you who have taken the communicable disease epi course have heard me say this before. The emerging infectious disease paradigm that we have right now is a really good one. It's right. The notion that emerging disease threats, the world is highly globalized, so something that affects one of us can affect all of us because we are so connected at this point. B, the threats are going to largely come at the human-animal interface. C, they're going to be accelerated by transportation networks. And if you think about this as seed and soil, where is emergence going to happen? Emergence is going to happen in very biodiverse parts of the planet, where we have, through population growth, through extractive activities, through settlement, we have a lot more interaction between humans and animals in ways that may be different from prior types of interactions between humans and animals. And if we have that seed, the soil will then be weak institutions, poverty, lack of public health infrastructure, and this tremendous global transportation web that lets cases move really fast around while they're still incubating. So that's number one lesson for me, is that there's actually nothing here that wasn't already in, the movie Contagion, or in the preamble to the And the Band Played On, the start of that movie. People have been musing about this sort of event for a long time. It fits very well with existing paradigms. The second thing that I've learned, and this I guess comes from a lens as a mathematical modeler, what I have come to appreciate over the course of the last year is how critically important behavior and behavior change are in driving how epidemics spread, and how little we know about those, and how poorly we can measure behavior and behavior change. Where even the cutting edge stuff, say, treating people as though they're geotagged because you can follow their cell phone around and say, aha, I'm going to have a sort of a mixing matrix based on cell phone movement. That's really fancy. It still doesn't tell us what people are thinking, what they're feeling, what they're fearing, how their attitudes might shift over the course of an epidemic, how their culture and their experiences, their mistrust of government and so forth might all interact to facilitate disease spread. So we've had a very biomedical lens in the mathematical modeling community in terms of what's going on. How many Ebola treatment centers are there? Are the personal protective items, are there enough of those on the ground to protect people? But we've really fallen short in terms of what people are thinking, what they're perceiving, how they're behaving. So I think that's a very fertile area for future work. The third lesson that I think we relearn in low-income, middle-income, high-income countries a lot, but to my mind, Ebola has underlined this, is that market-based approaches to drugs and vaccines bring with them a lot of peril. If you want business people to have sole ownership for development of your global seatbelt, if bad, rare events happen from a biomedical point of view, and you're relying on people who have to please shareholders to develop the seatbelt that you need to keep you safe if that unlikely occurrence comes to pass, you're going to be out of luck. I think there's a great lesson here in terms of a Public Health Agency of Canada developed vaccine that the patent was bought, it sat on the shelf, not gone into trials over the last 10 years, because who would ever need a vaccine, or how would you ever recoup your investment in such a vaccine? It would be stupid from a business point of view. It would have been really smart from a global public health point of view to have that in a glass case in case such an eventuality came to pass, which it did. But from a business point of view, it never would have made sense for an investor 5 years ago to say, I'm going to put X million or X billion dollars into bringing an Ebola vaccine to market, because nobody would have wanted it, and it would have been like setting fire to your money. So to my mind, this has underlined the failure of markets when what we're trying to produce is a de facto public good. And we know this. We can't rely on markets to produce public goods. So those are three things that I feel like I've really learned or had reinforced over the past year.
Sure. I have learned many things, and to try to distill them down into three, I think is an impossible challenge.
That's why we put it that way.
So I have four. I think what, just in the broadest possible terms, and I'll put these out with a view to catalyzing discussion and commentary and exploratory kind of process, which I'm very much hoping this seminar series will be. Because I think what Ebola demonstrates for us, in the very first instance, is the importance of humility and the importance of recognizing that we don't know everything and that failing to stand in relationship with a phenomenon like Ebola from a perspective of humility, in fact, is akin to throwing gasoline on the fire. You're actually making the situation worse if you fail to understand or to at least garner a greater understanding, a better understanding, a more perfect understanding of a phenomenon that is out of control. So with that in mind, there's a couple of key points that I would just highlight. One is the importance of governance, the importance of global governance. The Ebola epidemic represents a profound opportunity to see the failure of global governance. And it represents a profound opportunity to interrogate that failure in its fullest dimensions so that we can create, in the most optimistic of perspectives, better global governance mechanisms. The international health regulations were revised in 2005 following the SARS pandemic. And without going into detail now, we hopefully will, the Ebola epidemic demonstrates the limits of those reforms in the 2005 regulatory reforms. We still have massive holes in governance, and we still have massive systems that are deeply ineffective in terms of identifying, containing, controlling, mitigating, and adapting